Thank you, everybody. So I'm going to share with you some of the research that we've been doing within the Public Health Institute, and really draws on some of the research, some of the evaluation that we've been doing around community engagement and community participation. And we've heard some brilliant presentations today, and a lot of them all seemed to touch on and cover issues around how do we support people to become resilient, how do we enable people so that they can develop their skills to be able to be independent and to support their own health and well-being. And also looking at how we create partnerships and how we look at being effective in that way. So I'm going to share some of the research that myself and my team have been involved with, and draw on some experiences and some examples of that. And hopefully you'll find it useful and interesting. So we know that the issue around health inequalities is still a huge global public health concern, and there has been a number of interventions that have been developed at physical, political, social and economic levels, and they've all had differing, if not limited, effectiveness. And in some cases, it's shifted poverty away from the inner city towards the outer areas of urban places. And the Liverpool City region is no different. It's characterised by things like significant high levels of deprivation, high levels of child poverty, lone parent families, higher levels of incapacity benefits, claimants, high proportion of worklessness, particularly people with long-term conditions, and people who suffer with mental and behavioural disorders and diseases of the nervous system. These statistics are just the top level of that issue. And what I want to share with you is some of the research that we've done, which has been mixed methods. We have used quantitative evidence, but I'm going to share with you some of the more qualitative work that we've done, and really look at what the stories are behind the statistics, and give you some examples of evaluations that we've done of community programmes where they have shown to be effective, and to look at why they've been effective. So the statistics show these things, and we know from engaging with people living in the Liverpool City region that they live in really desperate conditions, that there's really extreme levels of social isolation experienced by people living across the Liverpool City region, and issues like vulnerabilities that they suffer. And this is something that came up in the previous session that I was part of listening to, and issues around fear, people being scared in their community, can really limit a person's ability to engage. Very low aspirations amongst community members, and people suffering with multiple long-term conditions. And this research came from some insight work that was done by an organisation, but then it's also been reflected in the primary research that we have then done as well. So this kind of issue is is something which it's such a problem, and we really need to look at how we can tackle that. These are some of the examples that people gave to us about what it's like to live in the Liverpool City region, some of the reasons why they feel those things, some of the issues that people face. And you can see that there's things like eviction, debt, people relying on food banks, people having issues around claiming benefits, people being very vulnerable, people struggling to get out of the house, and people having issues just filling out forms that they need in order to get their benefits. Again, just to kind of give a bit more context, for people living in the Liverpool City region, they face lots of problems, lots of issues, and this is just one example of Karen. So Karen was somebody who we met through a piece of work that we were doing, evaluating an asset-based community development approach. And before she'd engaged with this approach, this intervention, she talked about how she was harassed by her neighbours and she was scared. They were posting things through a letterbox, they were banging on her doors and her windows. She thought that it was a gang. She used to hide in her wardrobe. She was afraid of them. She wanted to make a complaint, but she was scared of any repercussions. And what Karen did was, through the asset-based community development intervention that I'm going to talk about, she was able to link in with a community connector. And they work at something called the speed of trust. So again, a lot of the conversations that we've had today and that we've heard today have been about the amount of intense resource that's needed to support these people who are living in communities, who are suffering with lots of different problems, different issues every day. And through the engagement that Karen had with the community connector, she opened up about why she was feeling so isolated and why she was in the position that she was. And she talked about the fact that she'd been in a state of severe depression for over 20 years. It was something that had started after she'd experienced a stillbirth, and this had affected her. People crossed the street to avoid her, friends stopped calling, and that was the beginning of her isolation, and she had never been the same since. This is another example of another person that we met. We've called him John. He was somebody who was struggling with benefits. He was struggling financially. He'd received his universal credit payment, and he had just 1 penny left after deductions. He needed support, and he was able to access the asset-based community development intervention. He needed support, and they were able to provide him the support that they needed and help him with that process. He had two young children to support, and it was close to Christmas, so you can imagine the amount of distress that he was in. And these two stories aren't alone. This is examples from other people that we've spoken to who kind of gave us a picture of what life was like before this asset-based community development approach became part of their community. So there was one person that just talked about hating where they lived. They'd been trying to move. They talked about their neighbours, people putting things through her letterbox, throwing rubbish in her garden, and smashed her shed. There was one guy who was just saying, you really are alone, try and deal with that. You don't even talk to a milkman in the whole of the week. There was another person that talked about the abuse that they'd received as a child and the fact that they needed support, but that they felt that there was no organisation that would help them unless they gave up their cannabis. And they weren't willing to do that. They didn't want to do that. And they felt that that was acting as a barrier for them. But there was no one that could help him. And then there was a lady that we spoke to who had started to be bullied at work. She thought that she had dementia, she was poorly, she felt suicidal. She'd got medication from her doctor but said that that wasn't enough. And she also had financial problems as well and got into debt. And these stories are just indicative of hundreds and hundreds of people who are living in communities across our country that have so many things to battle with every day that for them, trying to sort out their health and well-being is not a priority. They have so many other issues that need to be considered first. So what I wanted to do is just to briefly touch on asset-based community development and give you some examples from the research that we've done. This stems, some of you will be well aware of it as an approach from some of the work that was produced by Kretzmann and McKnight in the 80s and 90s. And they looked at what can people who are living in communities do together to make things better. The idea being that the development must start from communities, particularly in urban neighbourhoods. And just bearing in mind that this is something that was produced in the 80s, some of the language and the wording isn't perhaps what we'd use today, but it gives a sense of the framework of asset-based community development, or ABCD, is to look at the gifts of individuals within a community. The gifts of individuals within a community, so things like the people living there and the income that they bring about. Then to look at the things that support that community, so citizens associations such as churches, clubs and culture. And then to look at the umbrella institutions which support that community, so things like businesses, schools, parks, libraries, colleges and hospitals. So the resurgence of ABCD kind of came hand in hand with the 2010 white paper that was published, which was around developing healthy people, healthy communities, with a kind of nod to the fact that we need to do something in response to austerity. We need to look at how we can focus on mobilising the assets within our communities. And Cormac Russell is somebody that's been driving the current agenda. If you are interested, there's a link to where you can have a look at him talking about what ABCD is, but it's basically around focusing on what exists within communities to allow communities to have the life that they want. And this is an example of how assets are broken down from individual assets, so those things which are relating to the psychological and social aspects of an individual, things like self-esteem, social confidence and skills. And then looking at the collective community or social assets, and these relate to things such as social capital, social networks, reciprocity and efficacy collectively. So members of my team did a piece of research to look at what is actually needed for ABCD. It's a phrase which is bandied about a lot. Those of you who are familiar with it might have heard the phrase. You might have had experience of developing or delivering ABCD approaches. There's no one clear definition of it, and we often have seen it used or applied or implemented, but not really following clear principles of ABCD. So we did a piece of research to look at what actually is needed for it to be effective. And this was about understanding ABCD approaches from the perspectives of people working in communities. Examining ABCD, who it works for and what the benefits are, and understanding what the key principles are to that approach. It involved carrying out some interviews and focus groups with people from the third sector and voluntary organisations working in management and service provider roles, and really asking them about their experiences of working within that ABCD setting. So just quickly run through some of the key findings. One of the key issues was around relationships and trust being a mechanism for change, and this is something that I've had conversations with throughout the day with people talking about the fact that people are key drivers around community engagement. It needs to be driven by the heart of the community, but it needs to be driven by somebody that's got the motivation and the ability to do that. So some examples were given where people were talking about the strengths versus deficit approach, thinking about the relationships that we try and create, and not having services and being too constrained have an impact on that negatively. And having that person-centeredness approach creating stability. So looking at where people's needs are, but focusing around their assets and have that come from the individuals themselves. The idea of reciprocity and connectivity being really important, so it being about people and not services. This person was saying that the assumption is that the solution to a problem is a service. Sometimes we've just got too many services, and that can just muddy the waters. It's not always what we need. And somebody else talked about the need for communities. They can very much create their own solutions, and they often have the best solutions to the issues because they're experiencing the issues themselves. Accountability and reducing dependency was a key factor, so enabling local services as an organisations to feel that they're in control, but not having an interfering kind of network for people to be able to get on with it and to be trusted to develop their own approaches to community engagement and participation. And to move away from this culture of dependency, this person was giving an example of a parent and toddler group that somebody set up. It might have been there for 15 or 20 years, and that might carry on nicely, but then if somebody tried to come in and manage that externally, then that might then all just fall flat on its face. So it's about having that enabling approach. And then finally, about being able to develop a socially sustainable model. And this was very much something that all of the people that were interviewed felt that ABCD can offer that, starting with the community and looking at starting from the assets, starting from there and then working upwards. And this is, again, it reflects one of the conversations that we'd had previously around the evidence and using the evidence and how we sort of put forward the evidence base for something and the need for something to be there. And I've had discussions with people who have said, there's no evidence for this, but we know that it's needed and we know that it works, so why is that a bad thing? And I think that there is something to be said for who is it that drives the evidence? Is it the academics or is it the people who are living in the communities themselves? And so there's this idea that actually using academic evidence can sometimes stifle creativity. So I'm just going to give a really quick example of some of the impacts that can be seen through ABCD using some of the findings from an evaluation that we've recently done. And this was very much using an ABCD approach. It was a health-related worklessness programme, and it had 3 main work streams. The first one was about driving change amongst leaders and training key professionals to have them understand the importance of using communities and working with communities. The second approach was around community connectors, so people who were based within communities providing support for communities. And the third approach was having an intervention to support people who had low-level mental health conditions, who weren't necessarily on the kind of the periphery of, they were not in need of any more intensive support than just kind of the low-level support that could be provided within the community. So the findings that we had from this project were the importance of understanding somebody as a person. So we interviewed 121 people as a result of this project and to get the evidence that we needed. And the people who were working as the connectors really felt that it was important to build the trust, work at the speed of trust, understand the person, understand that they've had a bad life, but make no judgments. And there was this real issue about the fact that the connectors were more likely to be able to support people than statutory organisations might be able to. And the connectors themselves talked about lots of examples of how they opened the door to, people within the communities gave examples of how they opened the door to the connectors where they wouldn't have opened the door to anybody else. And this was a quote from somebody who talked about being suspicious of everyone, and the fact that they have been offered services in the past but that they've avoided them. We asked people about what would have happened if they hadn't have engaged with the connectors. So the community connectors, the main way in which they engaged with people was through door knocking, so they went out into the community and engaged with people that way. And one of the key things that they were able to do was to provide support where they needed it around lots of different areas, whether it was a support for debt or housing, or whether it was signposting them to a knitting group, for example. And we asked people what would happen if they hadn't engaged with this ABCD approach. And this was just an example from one person who had talked about that they would be at home and depressed, and they gave the example of where they'd worked in a factory and it was the worst thing that they'd ever done. And there's somebody else who talked about how they'd probably be a raging alkie because they felt that crap about themselves. And we had loads and loads of examples from people who said that where they previously felt suicidal, they no longer did. They felt like life was worth living. So just to summarise then, an asset-based approach can create change, and we have the evidence of that from a number of different pieces of research that we've done. It needs to use local resources and engage local people, but there needs to be time taken to build trust and respect, and it needs to have a very clear partnership model with clear channels of responsibility, communication and purpose that's defined with local partners, and these are the things that take the time to develop. A really quick note on the evidence. Obviously, we've collected a range of qualitative and quantitative data through the various evaluations and research that we've done. One of the key things that we found is that ABCD approaches can result in really small but very meaningful outcomes. So the data and the collection of the data really needs to reflect that. The outcomes often don't result in the immediate things that are specific to the programme. So, for example, the worklessness programmes that we've worked on, the main thing that they were collecting evidence of was employment. Well, they're never going to reach that because we have found that there's so many different things that they need support on before they're even ready to start to think about employment. So we needed to collect more sensitive measures, or we needed to use more sensitive measures to collect and demonstrate that a lot of resource is needed, and it's a lot of intensive work that's needed to be able to bring about very small changes that are meaningful, that in the very longer term will make a difference, that these aren't always captured within the programme timeframe. So this project was funded for 2 years, and within that we've got a small percentage who are in employment. So it hasn't met the target, but through that they've identified and been able to support change in a wider number of the communities. So we really need to make sure that we collect this information. And just a final note about the fact that strategies need to make sure that we reach those people who are most in need. It's really important that insight work is done to inform local community engagement interventions. Otherwise, the people who are going to respond, they're not going to be the people who need it most. And Jim talked about diffusions of innovation, and the laggards right at the end, they're the people who are so far away from wanting to change, and it's so difficult to change their behaviour. It costs money, it costs time, and you can focus on those who might be more likely to adopt behaviour change. But don't forget about how we make sure that we don't exacerbate health inequalities. The biggest impact will be by targeting the people most in need of it, and it is something that costs time and money. There's loads of resources there about the research that we've done, and if you are interested, then you can go and have a look at some of the videos that I've put links to there. Thank you.